Americans are trying to move closer to their pre-pandemic routines, but there are worrying signs that the virus is continuing to spread in some of the states that have eased restrictions. John Yang has a look at one of those states, Alabama.
In the Vintage Cafe in Montgomery, Alabama, the hustle and bustle is back.
We've done everything from change flooring from carpet to hardwoods, change all of our practices, promoting the use of masks.
Cooks have added extra precautions to their normal kitchen routines. Eric Rivera is the executive chef.
We wanted to bring all of our staff back in, give them the proper training, get all the new training and procedures in place before we decided to open back up to the public. We wanted them, again, to feel safe and secure coming into our establishment, and we wanted to feel safe and secure as well.
Business may be on its way back across Alabama, but so are cases of coronavirus, on an upward trend after April 30th, the day state officials began easing restrictions. In a state where college football is king, it's news that University of Alabama and Auburn University players tested positive this month when they returned to campus for workouts. And metropolitan areas like Montgomery, the state capital, have been hard hit. Mayor Stephen Reed, a Democrat.
I think anytime you have a 337% increase month over month, that's a problem, and that's what we had from the month of April to the month of May. And we also saw almost 80% of our deaths that we've reported so far occur in the month of May.
Alabama was among the last states to issue a stay-at-home order on April 3rd, and just 4 weeks later, among the first to begin easing restrictions. Beaches reopened.
We've been stuck in the house so long, so it's like, it's like a breather. We needed to get out, so I just thought I'd bring him out here to enjoy the sun and the water.
In person, though socially distanced, high school graduations were allowed.
Keep praying.
Church services resumed.
It's just nice to be able to get together with really family and just spend time together and worshiping God.
Right here in Sweet Home, Alabama.
Governor Kay Ivey, a Republican, announced the plan.
We cannot sustain a delayed way of life as we search for a vaccine. There are many viruses that we live with and have worked necessary precautions into our daily lives. Standing by and letting our businesses collapse while we've got hundreds of thousands of folks that are hurting and suffering is not an option. Having a life means having a livelihood too.
But we can't put the dollars over the data, and I think unfortunately that's what we ended up doing at the state level, and that I believe contributed to some of the increasing numbers that we saw, but also I think it just gave people a sense that this pandemic was over and that we had won this battle.
At Alabama's hospitals, though, the battle is far from over. Dr. Rachel Lee is an epidemiologist at the University of Alabama, Birmingham.
We are continuing to care for about 50 to 60 patients with COVID every single day. So what that means is that we have one ICU that's completely full of patients that have COVID-19, one acute care unit that's completely full of patients that are being cared for with COVID-19. And every single day we're having 2 to 3 new cases a day being admitted.
Lee says more study is needed to figure out what's behind the current surge, but says a contributing factor is the state of health care in rural Alabama.
If you're in a smaller area, you may have to drive a long distance in order to even get a test, and that test may be delayed because it has to be shipped somewhere else in order to get a result. So you can see how that infection could potentially spread from one person to the next if there's a delay in getting a diagnosis.
And the current state guidelines, she says, are too lax.
I think what's lacking with some of our recommendations is, we are open in terms of the amount of people that can be around one another. And then also, there's no real restrictions in terms of mask wearing inside retail businesses. And I think without those kind of guardrails up, it is potentially the possibility that you can see this disease spread from person to person.
In Alabama, masks are mandatory for workers at places like hair salons. At Envy Hair Designs in Montgomery, it's required for customers too. Tasha Curry is the owner.
You know, everybody has to wear a mask, and then we're making everybody sanitize as soon as they walk in the door. I'm right up on them when I'm cutting their hair and I'm doing their hair, so I just make sure I keep my mask on, make sure they keep their mask on.
On the streets of Montgomery, Mayor Reed wants to require masks in public, but says a majority of the city council opposes it.
We have to do it because of the surge that we've seen in cases in Montgomery, and more importantly, it is impacting disproportionately black people in this city in a region that has a high number of people with underlying health issues and other illnesses that make them more susceptible to suffering more seriously from COVID-19 virus.
As leaders and healthcare workers confront this current rise in cases, they worry about what could still be ahead.
If we saw another surge, we would really have to work on thinking through alternative methods to protect our healthcare workers. I think that's probably the thing that keeps me up at night the most.
And business owners Tasha Curry and Eric Rivera worry too, for a different reason.
Oh my gosh, I don't even want to think about having to shut down for another 2 or 3 months. We're going to pray and keep our fingers crossed that everything will be okay, and hopefully we'll make it through again.
And that's one of the things you think about every day is, are they going to close us back down if the cases get too high?
As experts say, people in Alabama and across the nation will likely have to face life without a coronavirus vaccine for some time to come. For the PBS NewsHour, I'm John Yang.